A good evening to all of you. We would like to welcome you to our first webinar, Dental Health, a Gateway to Better General Health. This is in collaboration with Health in Action, the India Association of Hong Kong, and Pakistan Association of Hong Kong. Throughout the past 3 years, we have worked with 2,500 service participants, 1,169 of them who have been screened and demonstrated how to do brush and floss effectively. We have worked across 7 districts in Hong Kong, reaching out to about 5 NGO partners and 100 students who have been impacted through their teaching and learning. Today is our first online webinar, so I'd like to give you some reminders. Kindly switch off your video and mute your sound at all times. If you would like to send a message, feel free to do it to the chat box. Any concerns you have or any questions you have will be answered during the Q&A session. We also have reactions like hand clapping or thumbs up to show your appreciation to the speakers and your thoughts. So without further ado, I would like to invite Ms. Miriam Leung, registered pharmacist, and Sushila Gurung, Health Ambassador of Health in Action, to share with us oral health tips that would be helpful during COVID. Thank you. Sushila Gurung.
Hi. Now we will talk about how to prevent COVID-19 from spreading.
तो आज हम कोविड फैलने से कैसे बचा जाए इसके बारे में बात करेंगे.
When COVID-19 get out of our body, it does it in 2 ways. One, in a larger droplet when patient breathes, talk, cough, or sneeze, and they can spread up to 1 meter.
जब कोविड-19 हमारे शरीर के बाहर निकलते हैं तो वो 2 तरीके से फैलता है. एक बड़ी बूंदों में जब रोगी बात करते हैं, सांस लेता और खांसता और छींकता है तो 1 मीटर तक फैल सकता है.
Another way is through smaller droplets. They can spread more than 1 meter.
एक और तरीका छोटी बूंदों के माध्यम से है और 1 मीटर से अधिक फैल सकता है.
But they are only generated in the hospitals where they are doing procedures on the airways.
और ये केवल अस्पतालों में फैलता है जब मरीजों को इलाज होते हैं तो वायुमार्ग से फैलता है.
So next, we'll talk about how COVID get inside our body.
तो हमें कोविड-19 हमारे शरीर के अंदर कैसे मिलता है?
It mainly does through nose, eyes, or mouth.
मुख्य रूप से नाक, आँख और मुंह से.
It can be through direct contact with virus or indirectly when hand touch surfaces like tables or doors that are covered with virus.
ये वायरस के सीधे संपर्क के माध्यम से हो सकता है या अप्रत्यक्ष रूप से जब हाथ टेबल दरवाजों जैसी सतहों के छूते हैं और वायरस से ढके होते हैं.
And when the hand touch nose, eyes, or mouth, then it gets inside the body.
और आप फिर आपके हाथ, आँख, नाक या मुंह को छू जाते हैं.
So the first tip is to prevent COVID-19 to get out or inside your body.
तो पहला टिप कोविड-19 को रोकने के लिए
and that is wearing mask.
तो मास्क पहनना है.
You should wear a mask even without symptoms. This is because up to 45% of patients do not have any symptoms, but they still do have virus inside the bodies and can spread it out when they breathe or sneeze.
तो आपको कोई भी लक्षण के बिना भी मास्क पहनना चाहिए क्योंकि 45% रोगियों में कोई भी लक्षण नहीं होते, फिर भी उसके अंदर वायरस होता है और वो फैल सकता है.
You should also wear a certified mask in high-risk area where they can generate smaller droplets. That is like in the hospital where they do procedure.
आपको उच्च जोखिम वाले क्षेत्र में प्रमाणित मास्क पहनना चाहिए जहां वो छोटी बूंदें उत्पन्न कर सकते हैं.
And then the second tip is to cover your mouth and nose when sneezing or coughing.
तो दूसरा टिप आपको आप जब खांसते और छींकते हैं तो आपको मुंह और नाक को ढक लें,
but do not use your hand
पर आपके हाथ प्रयोग ना करें,
so that you will not spread a virus to surface or let them spread through your hand indirectly.
ताकि आप वायरस को सतहों को नहीं फैलाएंगे या उन्हें आपके हाथों से नहीं फैलने देंगे.
You can do it like the drawings. Use tissues to cover your mouth and nose, or use like this.
आप टिश्यू के प्रयोग कर सकते हैं और आपके कोहनी से ढक के कर सकते हैं.
And the third tip is social distancing. This is to prevent virus spreading directly from one person to another.
एक व्यक्ति से दूसरे व्यक्ति से सीधे वायरस फैलने के रोकने के लिए सामाजिक दूरी आवश्यकता है.
Do you know how far apart should we separate ourselves to prevent that?
क्या आपको पता है इसे रोकने के लिए खुद को कितना दूरी पर रखना चाहिए?
You can put your answer in the chat box. Oh, we have some answer, is it?
Yes. So the answer says 1 meter, is that correct?
Yes,
Yes.
1 meter. Yes. So if you have any symptoms or get sick easily, you should avoid going out to eat at crowded restaurant.
इसलिए यदि आपके कोई लक्षण है या आप आसानी से बीमार पड़ जाते तो आप भीड़ बड़े रेस्टोरेंट में खाने के लिए बाहर ना जाएं.
Because you take off your mask at a restaurant and it is hard to keep 1 meter apart at a crowded restaurant.
क्योंकि आप रेस्टोरेंट में आपके मास्क उतार देते हैं या और आप भीड़ बड़े रेस्टोरेंट में 1 मीटर दूरी कर पाना मुश्किल है.
And the fourth tip is to disinfect the area.
और चौथा टिप कीटाणु रहित क्षेत्र,
which is all the surfaces, because virus can stay on surfaces for up to 9 days.
क्योंकि वायरस सतहों पर 9 दिन तक रह सकता है.
So disinfect it regularly or after someone sneezes or cough on them.
इसलिए इसे नियमित रूप से कीटाणु रहित करें.
You can do that with alcohol pad or the disinfectant as shown in the diagram, and the alcohol should be between 60 to 90%.
आप ऐसा शराब पैड से कीटाणु रहित कर सकते हैं अल्कोहल पैड से, और अल्कोहल 60 से 90% की होने चाहिए.
And the fifth tip is to maintain hand hygiene.
और पांचवा टिप आपके हाथ की स्वच्छता बनाए रखें.
And the best way is always using water and soap.
और सबसे अच्छा तरीका पानी और साबुन से है.
If there's no water, then you can use hand sanitizer.
अगर आपके पास पानी नहीं है तो आप हैंड सैनिटाइजर इस्तेमाल करें.
Again, the alcohol should be between 60 to 90%.
फिर से शराब 60 से 90% की होनी चाहिए.
If you, when you are doing both with water or hand sanitizer, you should wash your hand for 20 seconds.
जब आप हाथ धोते हैं तो कम से कम 20 सेकंड तक आपके हाथ को धोने चाहिए.
When you wash your hands frequently, then your hands get dry or crack easily.
और आप जब बार-बार आपके हाथ धोते हैं तो आपके हाथ सूख पड़ जाते हैं और आसानी से दरार पड़ जाते हैं.
So use moisturizer to prevent that.
इसलिए इसे बचने के लिए आप मॉइस्चराइजर का इस्तेमाल करें.
And the last tip, so avoid touching eyes, nose or mouth.
और आखिरी टिप, आप आँख, नाक, मुंह को छूने से बचें.
Because your hand may touch surfaces that are covered with virus.
क्योंकि आपका हाथ वायरस से ढकी होती है.
If you need to adjust your makeup, do that after you wash your hands.
यदि आपको आपके मेकअप मिलाना और फिर से लगाना हो तो आप आपके हाथ धोने के बाद कर सकते हैं.
So these are the very simple tips for how to prevent spreading of COVID-19 during this epidemic.
तो ये एक आसानी तरीका है कोविड-19 से बचने के लिए.
Thank you very much, Miriam and Sushila. Those are very interesting tips, and I'm sure that will all help us to be COVID-free, especially considering now the recent rise in cases in Hong Kong. We have to take a lot of measures to maintain our low number of cases. So now from 2017 onwards, one of the most helpful partners and most supportive partners that we've actually had has been the India Association of Hong Kong and Pakistan Association of Hong Kong. They've helped us throughout and continuously to reach out to the NEC community here in Hong Kong, and they've helped us to build our project and grow to the numbers that we have at the moment. With their support, we believe that we can continue to work closely with the government and reach out and make this project a success. So without further ado, I would like to invite Ms. Anita Gidumal, Vice President of the India Association of Hong Kong, to share with us her past involvements with the project and their future expectations from this project as well, and some of the feedbacks they've received from the participants. We'd also like to invite Mr. Mehran, the Assistant Club Manager from the Pakistan Association of Hong Kong. He will share with us the strong need for effective oral health practices amongst the community and the impact this project has had on the Pakistan community here in Hong Kong. So thank you very much, and I would like to hand it over to Ms. Anita and Mr. Mehran. Thank you.
Good evening, everybody, and thank you, Amrita. The India Association is delighted to continue its work with the University of Hong Kong Faculty of Dentistry on this very worthwhile project. Our thanks go to the University of Hong Kong, Health in Action, and other project partners that have made this project a huge success. A little bit about the India Association. The India Association Hong Kong was established in 1948 following India's independence. The association made an early commitment to promoting Indian heritage through cultural and social functions in Hong Kong. Over the years, though, the association has become a critical player in advocating for policy reform for Hong Kong's ethnic minority communities, advocating for better Chinese language policies, better access to education, and better retraining and employment opportunities. The association also awards scholarships to local Hong Kong students and gives recognition to public servants who have served the community selflessly. We participate annually in the Community Chest Walk and are one of the largest fundraisers for the event. More recently, we've also played a key role in ensuring the availability of dental care through the work we have done with the Hong Kong U Faculty of Dentistry in organising these very effective dental fairs. And through that, we've also helped with monitoring blood pressure, sugar levels, and we've also worked with other government organisations on flu vaccinations in order to provide these services to less well-off members of the Indian and other ethnic minority communities. So why did we get involved? Well, the India Association has a huge commitment to serving the Indian and other ethnic minority communities in Hong Kong. Hong Kong University Faculty of Dentistry approached us with this amazing project, and naturally it fit very well within what we do. We wanted to build awareness of the importance of oral health. As many of you know, the Hong Kong government provides primary school students with free annual medical checkups and annual dental checkups, but only at primary school level. This does not, unfortunately, continue through secondary and tertiary schooling or into our later years. Because of that, the previous page. Because of that, a lot of people within our community feel that they do not know enough about the facilities available for dental care in Hong Kong. People are unfamiliar with these facilities, unfamiliar with the support available. And so this project was a great way of building oral health care awareness. Also, through our membership and social media, we were then able to help the Hong Kong University dental faculty disseminate information to the community through social media and other channels and other partners we work with. Next, please. How did we get involved? What did we do? The association worked with HKU to organise 7 dental fairs across Hong Kong. These were spread throughout Hong Kong, as you can see on the screen: Jordan, Chai Wan, Yamate, Kwun Tong, Happy Valley. Many of these were organised in schools, as schools were able to provide facilities and help us promote these events. And for that, we must thank these schools for providing facilities to us at no cost. We could not have successfully done what we did if we had not had the support of the local schools. Through the dental fairs, as Amrita's already mentioned, approximately 1,200 patients of different ages, income and nationalities were screened. The fairs were very well received by the communities, but we need to continue with this initiative. We need to leverage on the success of the initial program. One of the questions we'd like to ask you is if there are locations members of the public would like us to hold and host these events later this year or in future years, please do let us know through the Q&A or email us. Would that be appropriate? The last page is members' feedback. We worked with HKU to arrange a focus group with some of our members. And on the screen, you'll see now some of the feedback we received from members. The dental health fairs were a great first step, but we need to continue the initiative. What people felt was that at the dental health fairs, a report needed to be provided to each participant, setting out what the issues were, what their dental health issues were, and guiding patients on the next steps. A lot of people didn't feel that there was enough clarity on what the next steps were. There is also a perception in Hong Kong that dental health care is very unaffordable. People need to understand and want to understand what facilities are available to them, what services are provided in Hong Kong, and what the cost of dental health care is. I know, having attended some of these dental health fairs, that it's only through this that I actually realized what was available at very minimal cost to people in our community. But we need to do more in order to disseminate this information and promote the facilities. We don't want people to return to India and Pakistan, Nepal and other countries for treatment, and you shouldn't have to. If you're a resident of Hong Kong, the facilities are available here. We just need, if you don't know how to access those facilities, then please let us know. The Prince Philip Dental Hospital is an amazing facility for people in Hong Kong to access, and Dr. Prasanna and Amrita will probably later talk more about how to access these facilities and the treatment available. One of the last points that was raised was waiting time. People feel that they wait a very long time for dental treatment in Hong Kong. They don't understand how it's prioritized. This is the feedback from our community. And I'd like to thank you again for taking the time to join us today. If there's anything the India Association can do to help, please let us know. We're here to work with the community, for the community. Thank you.
Good evening, everyone. Thank you, Amrita. I'll be putting some points on how dental health care is essential to an individual's well-being. As we all know, that importance of oral health is often overlooked, and there's a misconception that poor oral health only causes oral disease. In fact, oral health is a mirror of our overall health. And the mouth is an entry point for bacteria and viruses. Lack of care may result in oral diseases. These may contribute to other secondary health conditions in the body, and prevention of oral disease promotes a healthy immune system. So healthy oral conditions helps us perform basic human functions such as chewing, eating, or speaking with ease. Oral health affects our social well-being, as a healthy smile boosts our confidence and delivers positively on our social and professional lives. So routine dental visits will minimize the need for costlier and time-consuming and more painful treatments in the long run. So the conclusion we come up here with is it is important to establish good oral hygiene to ensure our body's well-being. I think I shall pass to the Amrita.
Thank you so much, Anita and Mehran, for sharing your thoughts and the feedback. It's really important for the community to realize that. And as leaders of the community, by you showing and having the encouragement for oral health, we believe that this would encourage others within the non-ethnic Chinese community to also come in and support this initiative. So thank you so much for being role models within your community and guiding us through that. Now we would like to welcome the man behind this whole initiative, Dr. Prasanna Neelakantan. He is a clinical assistant professor from the Faculty of Dentistry at the University of Hong Kong. We'll also be inviting Dr. Abrar Khwaja, MDS students, as well as Ms. Gunjan Gupta, the Year 4 BDS student. They'll be sharing with us how to maintain oral health, what are some measures we can take for self-care, and what is the right method to brush and floss. We do demonstrate it within the fairs, but unfortunately this year we can't have the fairs. So we thought we should include it as a part of what we do as well. So hope you enjoy the presentation, and hand it over to Dr. Prasanna, Abrar, and Gunjan.
Hello to all of you. Dental treatment is very expensive. It's very painful, and I often have to wait for months together to see the dentist. How many times have we told ourselves these things and pulled ourselves from visiting a dentist? What if we told you that there were simple home care approaches that you could do to avoid all of the above? Of course, any visit to the dentist is inevitable, but you could avoid all these painful or more expensive visits if you just followed some simple home care regimens. First, brush regularly, but not aggressively. Oftentimes we think the more pressure we apply during brushing, the cleaner our mouth is going to be, but that's not the case. What you need is a proper technique of brushing, but not necessarily the force.
तो जो दांतों का ट्रीटमेंट होता है वो ज़्यादातर बहुत ही ज़्यादा पेनफुल, मतलब बहुत दर्दनाक, बहुत ज़्यादा एक्सपेंसिव, यानी बहुत ज़्यादा महंगा माना जाता है. पर अगर हम आपको बताएं कि बस कुछ घर पे डेंटल टिप्स दें जो आप घर पे यूज़ कर सकते हैं और उससे आपको सारा आपका कीमती टाइम, आपका महंगा ट्रीटमेंट बच जाएगा, तो आपको कैसा लगेगा? ऑफ कोर्स आपको दांतों के डॉक्टर के पास फिर भी जाना पड़ेगा, पर हो सकता है कि आपका जो ट्रीटमेंट है वो इतना महंगा और इतना ज़्यादा कीमती टाइम आपको जो स्पॉइल होता है वो ना रहे. तो पहला टिप जो हम आपको देंगे वो है कि आपको हर रोज़ ब्रश करना चाहिए. ब्रश करना बहुत ज़रूरी है, दिन में 2 बार आपको ब्रश करना चाहिए. और ये ध्यान रखना है कि जब आप ब्रश करें तो वो ज़्यादा ज़ोर से, मतलब ज़्यादा ज़ोर लगा के, ज़्यादा ताकत से ब्रश ना करें. सारे दांत ब्रश करना ज़रूरी है, पर उनको मुलायम तरीके से धीरे धीरे ब्रश करना ज़रूरी है, नहीं तो आप अपने दांतों को नुकसान कर सकते हैं.
The next one, apart from a general health perspective, eating fruits and vegetables has advantages in your mouth as well. They are very fibrous foods and simply serve as a scrub by which they can remove all the dirt that is accumulated inside your mouth.
तो फल और सब्जियां खाना आपकी पूरी सेहत के लिए बहुत अच्छा है, पर आपके दांतों की सेहत के लिए भी बहुत अच्छा है. इनमें फाइबर होता है जो आपके दांतों की सफाई रखने में मदद करता है.
In addition to this, fruits and vegetables also give you a lot of essential vitamins and minerals that are responsible for healthy saliva as well as your healthy gums and other tissues inside your mouth.
जो फल और सब्जियां हैं वो आपके दांतों को मजबूत रखती हैं, वो आपके लार यानी सलाइवा को भी स्वस्थ रखती हैं.
Smoking. Oftentimes we just relate smoking to cancer. But what if I told you that smoking as such can change the germs inside your mouth to induce more of decay or more of gum disease? So be it e-cigarette smoking or routine cigarettes, all kinds of cigarettes are very detrimental to oral health from the perspective of causing cancer or as simple diseases as decay or gum disease.
ज़्यादातर स्मोकिंग को हम कैंसर के साथ जोड़ते हैं, पर स्मोकिंग आपकी दांतों की सेहत के लिए भी बहुत हानिकारक है. स्मोकिंग से आपके जो मुंह में बैक्टीरिया है वो चेंज हो जाता है, वो बैक्टीरिया हो जाता है जो ज़्यादा प्रॉब्लम, ज़्यादा बीमारी कर सकता है. जैसे कि अगर आप स्मोक करते हैं तो फिर आपकी जो मसूड़ों की सेहत है और जो दांतों की सेहत है वो ज़्यादा खराब हो सकती है.
I have a small assignment for you all. Once this webinar is over, go to your washrooms, take your brush, and see how dirty the base or the plastic base of your brush is. That's a simple reminder for you to tell you that you have to clean your brushes regularly. There is more than what meets the eye in terms of how clean our brushes are. And if what you use to clean your mouth is as such dirty at the base, then that's not going to reflect on what you're cleaning in your mouth.
तो डॉक्टर प्रसन्ना आपको छोटा सा एक एक्सरसाइज देना चाहते हैं। वो चाहते हैं कि आप इस वीडियो के बाद अपने बाथरूम जाके अपने ब्रश को ध्यान से देखें वो कितना साफ है और कितना साफ नहीं है। तो अगर वो आप उसके सारे ब्रिसल्स को देखें और उसके पीछे का जो सर के पीछे जो प्लास्टिक है उसको देखें, तो अगर वो साफ नहीं है तो हम आपको याद दिलाना चाहेंगे कि उसको साफ करना बहुत जरूरी है।
And of course, there's an advice which you're always told: eat less sugary food, and especially at night time, do not have sugars, because the minute you go to bed, your mouth starts producing much less saliva than in the day. And when you eat a lot of sugary food, you're feeding the bacteria and all microbes in your mouth with a lot of nutrition, and all they're going to do is start breaking down your teeth.
तो आपने ये कई बार सुना होगा कि आपको ज्यादा मीठा खाना नहीं खाना चाहिए, स्पेशली जब आप रात को सोने जा रहे हैं उससे पहले मीठा खाना बिल्कुल नहीं खाना चाहिए, क्योंकि रात को आपका जो लार है, आपकी सलाइवा है, वो काफी कम बनती है। तो जो मीठा आप खाते हैं वो बैक्टीरिया को बहुत पसंद है, वो उसको खा लेता है और एसिड प्रोड्यूस करता है और उससे आपके सारे दांत खराब हो सकते हैं।
And sugary drinks too. On a nice summer morning, all that we want to go to is a nice sugary soda. There's nothing more dangerous to your mouth and your teeth than these sugar-loaded soda drinks. So refrain from drinking them.
किसी भी बहुत ही गर्मी वाली सुबह आपको मीठी ठंडी सोडा पीने का कितना मन करता है, जैसे कि कोक, पर आपके मुंह के लिए और कुछ भी ज्यादा हानिकारक नहीं है। जो आप मीठी ड्रिंक्स पीते हैं वो बहुत ज्यादा बैक्टीरिया उसको बहुत पसंद करता है, वो उसको खाएगा और फिर आपके मुंह में एसिड प्रोड्यूस करेगा।
And toothpaste with fluoride is something which is very common knowledge. So you have to use toothpaste with fluoride because fluoride can prevent dental decay from progressing.
तो आपने सुना होगा ये बहुत ज्यादा जरूरी है कि जो आप टूथपेस्ट यूज कर रहे हैं उसमें फ्लोराइड हो। जो फ्लोराइड है वो आपके दांतों को ज्यादा ताकतवर बनाता है और जो कीड़े उस पर अटैक करेंगे उसको रोकता है।
Now there's an often concern for a lot of people that this fluoride is very harmful to them. So there is a small tip here. You don't have to load your entire toothbrush with the toothpaste. All you need is a small pea-sized amount of paste to establish its effect.
तो कहा जाता है कि फ्लोराइड आपके पूरी सेहत के लिए अच्छा नहीं है, पर फिर वो अगर आप अपने टूथब्रश पे थोड़ा सा अमाउंट डालें, जैसे कि एक मटर के जितना अमाउंट डालें, तो फिर ठीक है, आपको उतना ही टूथपेस्ट यूज करने की जरूरत है।
Whether you're someone who likes to chew on your toothbrush or not, or regularly just brush even normally, remember you have to change your brushes very often. The usual average time is at least about 3 months. So every 3 months, whether your brush looks like this or not, do change it.
ब्रश को रेगुलरली चेंज करना बहुत जरूरी है, तो अगर हर 3 महीने आपको अपना ब्रश चेंज करना चाहिए। हो सकता है अगर आपका ब्रश जैसे अभी पिक्चर में दिख रहा है, अगर ऐसा जल्दी दिखने लग जाए तो उसको पहले ही चेंज कर लें, पर अगर 3 महीने पे ऐसा ना दिख रहा हो तो भी चेंज करना अच्छा रहेगा।
And drink more water. Keep your mouth hydrated. The drier your mouth is, the more is the chance of you developing dental diseases, specifically decay.
पानी पीना बहुत जरूरी है। अपने मुंह को हमेशा बार-बार पानी पी के हाइड्रेट करना जरूरी है। अगर आप पानी पिएंगे तो रेगुलरली पानी पीते रहेंगे तो फिर आपके जो दांतों में कीटाणु जिसको कैरीज बोलते हैं वो काफी कम हो जाएंगे।
And use a tongue scraper or any form of cleaning your tongue. We often just focus on our teeth and forget the tongue. The tongue can house a lot of microbes and germs which can result in any kind of disease inside the body. So use a routine brush, the backside of your brush, or a specific tongue scraper to scrape your tongue every time you brush your teeth.
आपको दांतों के साथ-साथ अपनी जीभ को साफ करना भी बहुत जरूरी है। जीभ पे भी काफी खाना, काफी बैक्टीरिया जमा होता है और फिर आप इसको साफ करने के लिए या तो अपना टूथब्रश यूज कर सकते हैं या फिर जैसे इस फोटो में दिखाया है ये स्पेशल है, ये टंग स्क्रैपर है जो आपको
टंग की सफाई करने में मदद करेगा.
And of course, visit a dentist at least once in 6 months. Now, if you routinely follow all these home care tips, chances are that you're not going to go through any kind of painful or invasive procedure if you visit a dentist regularly.
हर 6 महीने बाद डेंटिस्ट के पास जाना चाहिए. अगर आज हमने आपको जो भी बताया है, अगर आप उसको फॉलो करें घर पे, तो फिर ऐसा माना जाएगा कि आप जब डेंटिस्ट के पास जाएंगे भी तो कोई बहुत ज्यादा महंगा ट्रीटमेंट नहीं कराना पड़ेगा.
And one free tip, which is not in these slides. We often think using a mouthwash is very beneficial to us, which certainly is not the case. Remember, your mouth contains both healthy, that's those germs that are friendly to you, and those germs that cause disease. When you use these mouthwashes that are available, you kill both your friends and the enemies, and you don't want to do that. So refrain from using any of the mouthwashes, albeit very rarely if you just want to use it for freshness, but never use mouthwash on a day-to-day basis.
एक आखिरी टिप जो इन स्लाइड्स में नहीं है वो है कि आपने सुना होगा कि माउथ वॉश यूज करना चाहिए, पर एक्चुअली में आपके जो मुंह में कुछ अच्छे बैक्टीरिया होते हैं, कुछ बुरे बैक्टीरिया होते हैं. माउथ वॉश क्या करता है कि वो सबको मार देता है. तो माउथ वॉश आपके मुंह के लिए एक्चुअली अच्छा नहीं है. तो हर रोज यूज करना जरूरी, उसको अच्छा नहीं माना जाता. आप कभी कभी बस उसके फ्रेश टेस्ट के लिए यूज करना चाहें तो कर सकते हैं.
First, most important tip for brushing your teeth, make sure you use a timer, okay? Best idea that I give my patients every day is take out your phone, put it on 2 minutes, twice a day, every time. Make sure you complete 2 minutes while you're brushing your teeth, okay?
तो सबसे ज़रूरी टिप है कि आप हर रोज़ जब आप ब्रश करें तो एक अपनी घड़ी साथ में रखें और देखें कि 2 मिनट आप पूरा ब्रशिंग कर रहे हैं. तो इसके लिए आप अपना मोबाइल यूज़ कर सकते हैं, उसमें टाइमर होता है, तो वो काफ़ी इजी रहेगा.
After that, using a toothbrush doesn't really matter what you use as long as it's soft and you're comfortable to use it, and make sure that the toothpaste you're using is fluoridated toothpaste.
आप कोई भी टूथब्रश यूज़ कर सकते हैं, बस ये ध्यान में रखें कि जो टूथब्रश आप यूज़ कर रहे हैं वो नरम हो, वो ताकि वो गम्स को चोट ना लगाए, और कोशिश करें कि उसका जो सर है, जो टूथब्रश का सर है, वो थोड़ा छोटा हो. और जो आप टूथपेस्ट यूज़ करते हैं ये ज़रूरी है कि उसमें फ्लोराइड हो.
Okay, excellent. All right, so when we start brushing, try to get the toothbrush head, aim it towards the gums about 45 degrees, okay? And then small circular motions. Each motion should cover about the length of one tooth.
आप जब अपना टूथब्रश लेते हैं तो उसको 45 डिग्री के एंगल पे अपने मसूड़ों के ऊपर एंगल करके रखना है और फिर छोटे छोटे गोल मोशन में ब्रश करना है. तो आप बस छोटे छोटे गोल मोशन में एक दांत को एक बार में ब्रश करेंगे.
So you start off, you can start off in the back. Something that can help you is to brush each tooth individually, one by one. A little bit, spend a little bit of time, few seconds on each tooth, small little motions, and try to do that all the way around.
तो आप पीछे वाले दांतों से शुरू कर सकते हैं। कोशिश करें कि आप एक बार में एक ही दांत को ब्रश करें और एक एक करके सारे दांतों को कवर करें।
So once you brush all the outside surfaces, then we move into the insides. You can tilt your brush and vertically and do nice small up and down motions. Same thing, one by one each tooth, and then go all the way around up and down.
एक बार अपने दांतों के आपने बाहर के सारे सर्फेसेस को साफ कर लिया है, उसके बाद ज़रूरी है कि आप अंदर के दांतों के सर्फेस को भी साफ करें। तो इसके लिए आप अपना टूथब्रश लें और उसको सीधा पकड़ के ऊपर नीचे वाली मोशन में ब्रश करें।
So that's toothbrushing. Moving to flossing, you can use any type of floss most of the time, whether it's flat or not, waxed or not, doesn't make that much of a difference. But you need to start off with a nice healthy amount. Wrap it around both of your middle fingers like that, and then use your thumb and your finger to maneuver it, okay?
तो आप कोई भी टाइप की फ्लॉस यूज़ कर सकते हैं। मार्केट में कई तरह की फ्लॉसेस हैं, जैसे कुछ गोल हैं, कुछ फ्लैट हैं, कुछ वैक्स्ड हैं और कुछ अनवैक्स्ड हैं। आप किसी भी फ्लॉस को यूज़ कर सकते हैं। आप फ्लॉस को लेके उसको कट करें, अपनी दोनों बीच की उंगलियों के बीच में डालें और फिर उनको घुमाएं, और फिर घुमाने के बाद अपनी पहली उंगली और अपने अंगूठे के साथ उसको पकड़ के उसको यूज़ करने की कोशिश करें।
Right. And how you maneuver it would be, you just kind of use both your index fingers to go between the two teeth, push down until it comes, and up and down, use both your hands like that on each tooth surface, okay?
जब आपने फ्लॉस को पकड़ लिया है, आप उसको दो दांतों के बीच में पहले आप उसको पुश करें और फिर ऊपर नीचे वाली मोशन में यूज़ करें। आप दांतों के दोनों सरफेस को क्लीन करें।
So you can do that. It's a bit difficult sometimes to go all the way in the back, but we always recommend try to get in between every tooth surface, not just the front teeth. So one by one, every small little gap that you can, make sure you remove any food that's stuck inside or any small bacteria that's built up over there.
पीछे के दांतों में ये यूज़ करना कुछ थोड़ा मुश्किल है, पर ऐसा कहा जाता है कि पीछे के दांतों से लेके आगे के दांत तक सारे दांतों के बीच में जो भी जगह है, सब में फ्लॉस को यूज़ करना चाहिए। इससे जो भी बीच में खाना फंसा हुआ है वो सारा निकल जाएगा।
Right. So toothbrushing, to sum up, twice a day, 2 minutes each time, and flossing at least once a day, especially at night.
तो आखिर में हम ये बताएंगे कि टूथब्रशिंग आपको दिन में 2 बार 2 मिनट करनी ही करनी है, और फ्लॉसिंग एटलीस्ट 1 बार दिन में करनी चाहिए।
Thank you very much, Dr. Prasanna, Abrar, and Gunjan, for sharing your thoughts. And hopefully now we can all get and take care of our teeth better, including me as well. I'm going to floss now more regularly. So now we'll move to the Q&A session. And so for that, we have a couple of questions. So we're going to unmute you one by one. So we'll start by unmuting Kabi. So Kabi, you can ask the questions you've asked on the chat.
Yes. So we just copy. So
K-A-A-R.
Yes. Not there. Not there.
Okay, so we'll ask the question because I do think it is an important question. What is the biggest barrier for ethnic minorities to access public healthcare in Hong Kong? And what can be done to improve the situation? Ms. Anita and Mr. Mehran, can you help us to answer the question?
I think we'll actually pass this to Dr. Prasanna because obviously this is a question that's been raised over and over again as to how ethnic minorities access dental health care. Clearly, it's not an ethnic minority issue, it is a Hong Kong issue. But so long as you are a resident of Hong Kong, dental health care facilities are available to you. But I think Dr. Prasanna is probably the right person to answer the questions as it relates to what access, how do people access, and the cost of doing this.
Yeah, thanks, Anita. So I think the primary barrier is in terms of information itself. Because when we started doing these scans, I still remember the first meeting that we had at IA when I came down to meet you. What we realized was that most ethnic or the so-called non-ethnic Chinese here had no clue of where they could go for dental treatment. Of course, dental care for the general public in Hong Kong, unfortunately, is very limited. They can only go to either private hospitals or NGOs, or probably come here to Prince Philip. And of course, understandably, private hospitals are expensive for anyone in Hong Kong. So which is why I think a lot of people prefer to fly back home for treatments. But NGO-based dental care and Prince Philip Dental Hospital are excellent facilities which a lot of people do not know they can have access to. Of course, that also said, there is often a very unrealistic expectation of not having a waiting time. We have to let our people know that as such, amongst the developed countries, the waiting time in Hong Kong is extremely low compared to countries like the United States, where you need to wait at least a year or year and a half to have even the mildest treatment done. So that's because if you go to India, for example, and you want to visit a dentist, it is the likelihood of you being seen the same day and treated the same day is very, very high. But the same system does not exist in most developed countries because our working times are very different. So as long as we are able to educate our people about where they can go and also tell them what the realistic expectations should be, I don't think we'll have these problems in the future. So for me, the biggest barrier I would say is in terms of information itself and nothing else.
On that point, Dr. Prasanna, could you please either let our audience know today or as to what website they can go to or where they can access the information on these NGO facilities, the Jockey Club facilities, and the list of places they can go to for dental cleaning, extractions, basic things.
All right. Unfortunately, an all-comprehensive website of that nature does not exist, which is why during our camps, we made an effort to make those list of camps. And if there are people, when we organize these camps, for example, if people have any specific questions about where they can go, we're always ready to help them. Because these are not normally available in the public domain. So these were created by us to give information to our people. So what we can do probably is, if anyone has a specific question, or we could send out the list of the agencies that we made previously to the NGO partners or our KE partners, and they can disseminate the information. That would be probably the optimal way to do things.
So for any specific questions, you can email us at dentalhealthcare@gmail.com. Now we'd like to move on to the next question. Mehran, do you have anything to add that missed?
We certainly agree with Prasanna regarding the information. It should be disseminated on every available platform, whether it is electronic or any kind, maybe on websites or anything. So I fully agree with Dr. Prasanna. I think everyone should do their part, basically. So and educate the people where make some awareness among them. So I think that's the point here.
Thank you so much for sharing. Going to the next question. So with COVID now, will wearing mask all the time affect dental health? Do we need to change the mask all the time? The question from Suraj. Maybe Miriam, you can help us to answer.
Regarding the dental health, really look to,
I can answer.
But maybe just general health first.
generally, for how frequently you change your mask, it depends on how dirty your mask gets. So it depends on whether you have coughed on it, whether you have spit on it, whether there is rain raining down on your mask. And usually it's just changed once daily. But if you happen to have it got dirty, then you have to change it more regularly. So if you run and then you have many sweats on your face and then your mask got wet, then it is not an effective barrier anymore. So you need to change it as well.
And will wearing a mask all the time have an impact on the dental health? Most likely not, because you don't get dental infections per se on a communicable basis. Those bacteria always reside in your mouth, and this is not something which you can get in from the air and then can cause an infection inside your mouth. So wearing a mask is not going to enhance or deteriorate your dental health.
Thank you so much for sharing. We have a question from Sarah. So she asks, can we travel now? Cases in Hong Kong are less now, but more cases in Pakistan. What could countries like Pakistan do better? So maybe Mehran or Miriam can help us to answer.
But
Yeah,
assuming
that's
it
right, yeah.
resumes,
We've got charter flights actually.
That's to bring
Not
people back here.
Exactly, yeah. Well, I think in the past they did some very good work. The government of Hong Kong and Pakistan and India, they brought back many people. And I don't really understand why people go. Like Miss Anita said, there are many resources available in Hong Kong to get it treated. And yeah, there are some difficulties that financial, whether maybe waiting time. So I think we should, they should overcome these things. But of course, it will be done gradually. You can't do it right away. So that's why I think, there are steps needed which should be taken.
I think what we'll do, what Dr. Prasanna suggested, we'll get the list back. We'll disseminate that list of all the NGOs, the facilities available, where people can go, so people feel they don't have to get on a plane to receive treatment in another country.
Probably one more thing that there's a language barrier as well.
Certainly.
It's the very important thing.
Translators.
Yeah, because I think translators are available, but of course they're not very precise. There is some difference, a word or two or three. No one can convey their message unless you speak Cantonese or maybe they can speak English. So I think that's also one thing that should be noted.
That's true. There is a certain language barrier. So apart from the fact that most of the information has to be disseminated in a large variety of local languages, I think some efforts also have to be made, which we are in the process of planning, to have specific services to reach out to these target communities. Because from the context of interpreters, again, it's not a cheap service. There are costs involved, and who bears the cost is always going to be a question. So dedicated, targeted services for these needy groups are definitely required, and which is something we have been looking into for the future. Now, from our events, it's pretty clear that there is a need. Now, the next step is to go and look at potential stakeholders and ask them for some kind of support to see how well we can deliver the treatments that these communities need.
Thank you so much for sharing. Miriam just wanted to add, is it safe to travel now, just from your knowledge?
So when you travel, because for Hong
Let's say
Kong,
in emergency situations.
for emergency situation, if you need to travel, if you travel out from Hong Kong, this I would say it is not a very big risk of you getting the disease transmitting from Hong Kong to another place, because we do have very low rates of local transmission right now in Hong Kong. So it is very unlikely that you will infect other people that you arrive at your country, at the country that you arrive at. But when you come back to Hong Kong, that's the problem. So if you have emergency situation, you need to go out, and after you deal with that, and when you come back, then there will be a period where you need to quarantine yourself for 14 days, because it takes 14 days. Sometimes takes 14 days for the symptoms to further. And so during the 14 days, you need to stay in your room, limit your interaction with the family and friends, and always monitor your temperature and any symptoms involved.
Miriam, as you may or may not realize that if people are coming back to Hong Kong from India, Pakistan, Nepal, Bangladesh, they're not allowed to quarantine at home. They must quarantine at government facilities. So really, unless you have to go, why would you want to go now? Because when you return, you will likely have to quarantine at a government facility.
Thank you. So one of the questions from Raj is, why did you start this project and any new plans? I think you've answered in regards to new plans, but maybe if you can share the inspiration behind starting this project.
I moved to Hong Kong in 2016 from India. And then I have met a lot of Indians here. You go to dinners, you go to restaurants, you meet people. And the minute they know you are somebody from the medical field, the next question immediately is, oh, but dental treatment in Hong Kong is so expensive, we don't know where to go. And when I heard that repeatedly from a lot of these people, my next job was to write an email to India Association. So I reached out to Vijay first, and I asked Vijay, should we have a meeting? And then when I went for a meeting with Vijay and Anita, and when I spoke to them about dental facilities, I was rather surprised that Vijay and Anita gave me the same response that most others gave me. They did not know where to go. So I think that was the inspiration, where you come from a country and then you see that people from your country do not know where to have their services done. And I should say it's probably a way of giving back to our diaspora, as simple as that.
Thank you so much. So the next question is, what is the reason for having yellow teeth or bad breath, and how to actually make them go away?
All right. So these are normally attributed most times to some kind of gum diseases. And yellow teeth can, by nature, some people could inherently have yellow teeth. Or if you are aggressively brushing your teeth, like we said, you could be losing the layer of enamel on your teeth, which is responsible normally for a certain amount of whiteness that you have. So the more aggressively you brush, the more chances are that you lose your enamel and the teeth become more and more yellowish. And yellowish coloration could also be attributed to the kind of foods that you eat, to be a lot of acidic drinks that you drink, which wears away all the enamel. So that's to do with the discoloration. Halitosis per se is because of gum diseases. If you do not have a regular dental cleaning done, or if you don't have proper brushing techniques, then you're likely to develop any of these diseases. Apart from the dental causes itself, you may have some stomach disorders, which can also manifest in the oral cavity as halitosis. So if you've had regular cleanings done from your dentist and still have this problem, it's time you probably visit a gastrointestinologist.
Thank you so much. The next question is from Amrita. So she or he asks, I want to ask, do you give any dental appointments in PPDA dentists?
Do I, as a person?
No, what's the process maybe to get dental appointments?
Anyone can walk into PPDH for treatment. But remember, there are waiting times, and it's impossible to say how long one has to wait, because that would depend on the number of patients who walk in every morning. patients sometimes start queuing up as early as 6:30, 7 o'clock. And when you walk in at 8:30, you may have crossed the quota required for that number already. So although it may sound like a joke, truth be said that a lot of times, whether you're seeing that schedule or not, is probably a lot of luck involved as well. Because we do not know exactly how many patients are going to walk in every day for screening. So any person can walk into PPDH, schedule an appointment for treatment as you would do in any other dental facility. And the consultation charges are very low. It's just about $50 per visit. Treatments are very cheap. And remember that treatments are done by dental students under the monitoring of staff members. So we are very proud of the very high quality of dental care that we provide. Rest assured that the care is going to be world standard, but you have to have a bit of waiting time, which cannot be avoided.
So I think this question would be a nice summary. So I'm going to skip to one more question and then go to the last question from Tika. So Dr. Prasanna, you mentioned that we should avoid sugar at night. So does this actually refer to fruit and bread as well? Or when you say decrease sugar, what do you mean?
All right. Complex sugars are never a problem. Direct consumption of sugars, if you're going to have a piece of cake or an ice cream, or you're craving for some kind of dessert, that's something which is strictly a no-no. But fruits are okay. But regardless of that, we would never recommend that as the last thing before you go to bed. So if you are going to have a piece of fruit, ensure that you brush your teeth, rinse your mouth before you go to bed.
So I think this would be a nice last question. So it's a couple of questions. Maybe all of us can give a quick answer to that. So has the dental health fairs been impactful? Are there any future events coming up? And which districts do you think needed the most in Hong Kong?
All right. So the impact aspect, I think it has to come both from me and the NGO partners. From my perspective, or from the dental faculty's perspective and our students' perspective, we would consider this tremendous impact because we have gained substantial knowledge on the oral health status of the non-ethnic Chinese community in Hong Kong. And for our students, it's been an amazing learning experience because they've been able to interact with people from different lifestyles or different cultures, and that's been a big learning experience. And going further from this knowledge that we have gained will eventually translate into what we can do in terms of care we can provide to them. So what we're looking at is a long-term major impact from these events. And I think Anita could probably add up on what you think is the impact.
Thank you, Dr. Prasanna and Amrita. The impact's been huge because we've been able to provide information to people where they didn't have that information before. People are normally quite scared to go to dentists. When you go to a dental health fair with 200 other people, the fear factor goes away because it's just one of those things that everybody's doing. You see everybody doing it, you feel much more comfortable about it. So I think the next step, getting the information back out to the communities, because obviously 2 years ago we produced these leaflets, we distributed them to people, we put them on social media. We'll get the list back again, and we will make sure that through Pakistan Association, India Association, and our NGO partners, that we will promote that and disseminate that information. In terms of which locations for the next dental fairs, obviously we definitely want to have dental fairs again later this year or next year. We've obviously got to look at the health situation in Hong Kong, but where we would do them. Our communities, our ethnic minority communities tend to live in certain areas in Hong Kong. Definitely Yau Chi Mong, the Tsim Sha Tsui area would be one that we need to go back to. Obviously we've had dental fairs at these locations previously, but we would go back to those locations. Perhaps now we might look at other places like Ching Yi, we might look at places, we would obviously have to look at Chai Wan perhaps, but Yes, so there's a number of places, and that's where actually we look to you. If you can let us know through Pakistan Association, India Association, and the NGO partners where you would like to see the dental fairs, then we will try our best to accommodate that request.
Probably Sanju.
Yeah.
It's a huge concentration of EMs.
Yeah.
And Leung, Gupta. So it helped people.
Yeah, and Chung as well.
Yes. Leung, Timur, and basically the North New Territories. We haven't been there.
Yeah. Well, Amrita's given you the email address, so it's dentalhealthfair@gmail.com. Please email us with any questions you have, and we'll try and answer them. And also give us feedback on this, and also let us know where you would like us to have dental fairs next year.
So yes, impact of the project has definitely been a success. We have received feedback from our students who have participated, from the faculty staff, from our NGOs, and definitely it has shown to us that we need to continue doing this. Once again, the email is dentalhealthfair@gmail.com, one word, or you can go to our Facebook page as well, and it's www.facebook.com/dentalhealthfair. If you have any issues, do let us know, and we'll try to help you in any way possible. In regards to one of the questions from Nabita, she asked us to repeat the answer about the dental appointments. So you have to do walk-in appointments. It depends, there's a waiting time, so just come in, see the situation, and be patient with the treatments here as well. But definitely it's world-class services, and we hope that can help you. So, and you also can make appointments at NGO facilities. So there's Hope Worldwide if you're in Shamshepo. There's also Project Concern that's all over Hong Kong. Jockey Club as well. We will be definitely posting a list with all this information onto our Facebook page. You will also be able to find it on Indian Association, Pakistan Association, and Health in Action as well. So if you have any questions, feel free to reach out to any of us. So thank you very much for participating in our Zoom webinar, Dental Health, a Gateway to Better General Health. We would like to thank Ms. Miriam Leung, Ms. Sushila Gurung, Jazz from Health in Action for helping us to organize this event, Ms. Anita Gidumal, Mr. Mehran Khan from the India Association of Hong Kong and the Pakistan Association of Hong Kong, and the team that supported us as well. And from HKU, Dr. Prasanna for always guiding us throughout these initiatives and being the man behind this whole event that's been happening, Ms. Gunjan Gupta and Dr. Abrar Khwaja. And so we hope that with the support of the Faculty of Dentistry, the IT team, the PR team, we've been successful in organizing this event, and it's run very seamless. So thank you so much to everybody, and hope you have a nice day and enjoy the rest of your evening. Thank you.
Thank you.